Hello and welcome to this week's edition of the OncoAlert Weekly Roundup. I'm your host, Gil Morgan. As always, we're bringing you the most important updates from oncology research across tumor types, distilled into the key takeaways you need to know. A reminder that these are just some of our picks, and for a deeper view, we invite you to register for our newsletter at www.oncoalert360.com or through the QR code or link in this post. That's www.oncoalert360.com. Now let's dive in, starting with breast cancer, where Pfizer announces positive top-line results from the phase III HER2CLIMB 05 trial. This study evaluated the addition of Tucatinib to first-line maintenance therapy with trastuzumab and pertuzumab in HER2-positive metastatic breast cancer. The results showed a statistically significant improvement in progression-free survival, with a safety profile consistent with what we know from the individual agents. Although these are very positive news, we look forward to seeing the full results. And staying in breast cancer, we have some exploratory biomarker data from the KEYNOTE-119 trial in metastatic triple-negative breast cancer. Pembrolizumab didn't improve overall survival versus chemotherapy in previously treated patients, but higher tumor-infiltrating lymphocytes, T-cell inflamed gene expression profiles, and tumor mutational burden were associated with improved response rates, progression-free survival, and overall survival with pembrolizumab. In parallel, our new review highlights the challenges in young BRCA1/2 carriers with early breast cancer, underscoring the importance of personalized surveillance, risk-reducing strategies, fertility preservation, and targeted treatments like PARP inhibitors to optimize outcomes and quality of life. And moving on to lung cancer, the phase III PACIFIC-2 study evaluated starting durvalumab concurrently with chemoradiotherapy in unresectable stage 3 non-small cell lung cancer. The results showed no added benefit in progression-free or overall survival compared with placebo, reaffirming that consolidation durvalumab following CCRT remains the standard of care. On a more positive note, a phase II trial combining osimertinib with consolidative radiotherapy for advanced EGFR mutant non-small cell lung cancer reported a median PFS of 32.3 months and OS of 45 months, substantially exceeding historical outcomes. This highlights the potential for combining targeted therapies with precise local interventions to prolong disease control. In GI oncology, a pooled analysis of 197 patients with resectable dMMR MSI high gastroesophageal adenocarcinoma showed that neoadjuvant immune checkpoint inhibitors dramatically increased pathologic complete and major response rates compared with standard FLOT chemotherapy. While the event-free and overall survival were similar, this data support ICIs as highly effective preoperative strategy and provide a rationale for exploring organ-sparing or even non-operative approaches in selected patients. Turning to GU oncology, a phase II trial in oligometastatic clear cell renal cell carcinoma demonstrated that metastasis-directed radiotherapy without systemic therapy achieved a median system therapy-free survival of 34 months and a median PFS of 17.7 months, with minimal high-grade toxicity. Similarly, a large multi-center French cohort study of salvage prostate brachytherapy for local or recurrent prostate cancer showed a median biochemical progression-free survival of 40 months with a manageable late GI and GU toxicities, further emphasizing the role of careful targeted and local interventions. In gynecological cancer, a retrospective study in stage 3C cervical cancer found that an external radiotherapy boost to positive lymph nodes improved overall survival, particularly for patients with fewer or smaller nodes and when combined with concurrent chemotherapy. Across tumor types, we're also seeing ongoing innovation in reirradiation, where advances in precision radiotherapy allow for effective salvage strategies, albeit with careful patient selection and multidisciplinary planning to manage the risks. So what's the takeaway this week? Whether through combining systemic and local therapies, optimizing sequencing, or leveraging molecular profiling, these advances are moving us closer to treatments that are not just effective, but also tailored to the individual patient disease, biology, and life circumstances. That's all for this week's OncoAlert Weekly Roundup. I'm Gil Morgan, reminding you to stay curious, stay informed, stay hopeful, and stay OncoAlert. Look forward to seeing everyone here in Berlin for ESMO 2025.